Alright, so my disease is Timothy syndrome, and what this is it's a mutation in the gene that codes for calcium channels in certain cell membranes, and what the defect is, it's on the exons in some of these genes, and there's two exons that are affected, and one is the 8 exon and the other is the 8A exon, which is they correspond each one to the two different types of Timothy syndrome. There's a classical and atypical, which the 8A exon is accompanied with the classical, and then the 8 is accompanied with the atypical. And the issue with that is these transport membranes for the calcium, when muscle contractions happen, when the cell depolarizes and repolarizes, the depolarization happens for too long of a period. So this causes, in the heart muscle, it causes a longer QT interval, or segment actually, and on the EKG, instead of the segment looking like this, it expands it like this, and that, since the QT interval is corresponds with ventricular contraction and relaxation, it takes a longer time for this to happen. So it causes problems with, since this is happening so long, sending blood out of the ventricles is a very important part of blood transport, more so than, I guess, blood getting sent from the atrium to the ventricles, since the ventricles are in charge of moving blood to the lungs to get oxygenated, then coming back, and then moving it out to the rest of the systemic circuit. So we got the organs like the pancreas and stomach and all these that need oxygen. So if they're not getting adequate oxygen, then they could die from cell death. And let's see. So we got that. That is one of the main symptoms, is the long QT segment. And another characteristic thing, which only happens in classical, is syndactyly, which is a fusion of either the toes or the fingers. So it's kind of like this. It's fused like this. Since this is a congenital birth defect, these children who have it, they usually don't live too long, because the long QT segment can cause a ventricle defibrillation, or fibrillation, which leads to death. And I think we all remember that on the EKG. It just looks like a bunch of squiggly lines. So the lifespan for these children is usually like 2.5 years, but let's see. This disease is extremely rare, so I think there's only like 25 reported cases as of 2011, and diagnosis is usually done by EKG and the presence of syndactyly, which strangely enough, in atypical, syndactyly doesn't occur. But the difference between the two is, since the 8 exon codes for a lot more calcium channels than the 8A. I think it's like 80% for the 8 versus 20% for the 8A. These the atypical type is a lot more deadly. So since there's more defective calcium channels, and it leads to a higher chance of ventricular fibrillation. For treatment for these children, they usually do anti-arrhythmia drugs, which help with the strange rhythm. That I forgot to mention, that the long QT segment leads to a rhythmic pattern of the heart. And another thing is they implant a pacemaker to kind of combat the defective sinoatrial node, which sets the heart back to its normal rhythmic pattern. And another thing is they artificially put in a defibrillator, just in case they go into like ventricular fibrillation and have a chance of dying. It will kind of shock the heart back to normal function.